I fall into so many marginalized groups. I am an African American woman, I'm a lesbian woman, I have invisible disabilities. I'm constantly fighting for people in my community to feel healthy and be healthy. I think even if you're going to the doctor, just having questionnaires that ask these questions ahead of time would really be helpful so people don't constantly feel like they have to tell a story and feel uncomfortable all the time. I practice health equity in my work and here at the American Cancer Society through the work in the LGBTQ Allies employee engagement group. Recently we did a Pride launch party. We educated staff about the resources that are available here and let them know like the best language to use when they're in the community. Even working with volunteers and making sure that I am recruiting a diverse pool of volunteers that represent the American Cancer Society and represent the community that we live in.
Health equity is important to the American Cancer Society because as a large cancer-fighting organization, we have the ability and the resources to really be advocates for those who need the most assistance and those whose voices who need to be heard. One of the biggest barriers that we see in regards to cancer survivorship is access to care. So we do everything that we can on the local, state, and federal level to advocate for policies to improve access to care for everyone. Policy has the ability to make broad-scale public health change. The organization really making this a point is exciting. It's something that we hear about and we talk about, but being able to engage on this firsthand is a really phenomenal opportunity to do better for the people in our communities.
Hello, everyone. Welcome to Speak Up for Your Health, Cancer and Wellness in the LGBTQ+ community, hosted by the American Cancer Society. I'm Amanda Crawford. I'm an anchor on 7 News WHDH in Boston, a longtime supporter of ACS. My pronouns are she and her. On behalf of everyone involved, I want to thank you for being a part of this conversation. We are so excited that we've gathered voices from across New England and around the country to discuss LGBTQ+ health and wellness and reducing cancer risk. The American Cancer Society convened this event because cancer is a disease that can affect anyone, but it doesn't affect everyone equally. This program will aim to help members of the LGBTQ+ population across New England feel empowered and equipped to have discussions with their healthcare providers around cancer prevention and early detection. While many of you are likely familiar, it's important to remember that for underrepresented communities suffering unequal treatment, the cancer burden is amplified. Institutional structures can affect every step of cancer care, from prevention and screening to treatment and the quality of life during survivorship. And research confirms the LGBTQ+ community has a disproportionate burden of cancer, a higher prevalence of some risk factors, and faces barriers to accessing health care beyond those of the general population. The American Cancer Society believes everyone deserves a fair and just opportunity to benefit from progress made in the fight against cancer. With us today to talk more about the work behind the life-saving mission is Tawana Thomas-Johnson, the Society's Senior Vice President and Chief Diversity Officer. Tawana's playing a dual role today, and we'll see her as our panel discussion moderator later on. Now, before we begin, a couple of quick reminders. We invite you to follow this broadcast chat to the right of your screen to continue the conversation, expanding on what we're discussing here. And we ask that you be courteous and respectful in using the chat and be open to the individual ideas, experiences, and viewpoints shared as part of this program. Disparaging comments will not be allowed. Finally, a grateful thanks to the sponsors recognized on the screen before and after today's program. And with that, let's begin.
Hello, everyone. I am Tawana Thomas-Johnson, and I serve as the American Cancer Society's Senior Vice President for Diversity, Equity, and Inclusion, and as our Chief Diversity Officer. I'm also a member of our CEO's executive team, and I'm so excited to be with you all today having this critically important conversation. As an organization, we are working with our staff and our 1.5 million volunteers to create a workforce reflective of the communities we serve. We're working to ensure that our programs and services are equitable, culturally relevant, and that they center the needs of cancer patients and their families. Undergirding these efforts is what we're doing to create an organizational culture of respect, equity, and where everyone feels a sense of belonging and feels like they can thrive. Like many organizations, over the last 18 months, we have challenged ourselves to deepen our thinking around diversity, equity, and inclusion, and to accelerate our efforts to drive meaningful outcome and impact. We've expanded our partnerships with diverse external organizations, including some that are participating with today's discussion, to help us ensure that our DEI strategies are relevant and will help us advance health equity. We know that cancer does not affect everyone equally. We know that diverse communities bear a disproportionate burden of cancer, and so we have increased our research funding to find answers. We've increased our outreach efforts to communities that have the greatest needs, and we are educating our staff, our volunteers, our clinical partners, so that they become more competent and confident in reaching into all communities with life-saving information on cancer prevention and early detection. At our heart, the American Cancer Society is a convener of organizations and community members who all share a common goal: a world without cancer. Conversations like the one we are having today are an important step on that journey. So thank you for your participation and your commitment to a world without cancer.
Hello again. We are so grateful for Tawana's time today. It's energizing to learn more about the work that ACS and ACS can do to promote health equity. And beyond that, hopefully you'll leave today with other ideas about how we can all participate in that mission. Next, we'll hear from an American Cancer Society-funded researcher, Dr. Brittany Charlton. Dr. Charlton is an assistant professor of epidemiology at Harvard Medical School and the Harvard T.H. Chan School of Public Health. She's also co-director of Harvard SOGI, Health Equity Research Collaborative. SOGI is an acronym that stands for Sexual Orientation and Gender Identity and Expression. Dr. Charlton's work is part of the American Cancer Society's research program that aims to better understand factors that lead to cancer inequalities and create strategies to overcome them. The Society currently supports 65 multi-year extramural grants focusing on disparities, an investment of more than $62 million, supporting promising scientists and healthcare professionals at institutions all across the U.S. Let's listen now to Dr. Charlton discuss the importance of data collection to drive systemic change in the healthcare system.
Hi there, my name is Brittany Charlton. I use she, her pronouns. I am an assistant professor of epidemiology at Harvard Medical School and the Harvard T.H. Chan School of Public Health. I'm also the co-director of the Harvard SOGI Health Equity Research Collaborative. I've been fortunate to have support from the American Cancer Society for the last several years, specifically to examine cancer disparities that are impacting the LGBT community, specifically examining sexual minority women. I thought I would join you all today and just give you a really sort of brief overview of some of the ways that we're approaching this research and the way that research may fit into our community's thinking around this topic. We think it's really critical for us to improve data collection, for example, so that we could really better understand some of the cancer disparities that are impacting all of us. And for more than 2 decades, the National Academy of Medicine and many other organizations have warned of a potential increased cancer risk among LGBTQ folks. We know that there are risk factors that are more common among LGBTQ folks than among their heterosexual or cisgender peers. For example, we know that LGBTQ folks often face discrimination and stigma, and therefore may use tobacco or alcohol as one way to cope, which of course then puts them at risk for cancer. National cancer registries unfortunately don't collect information around sexual orientation or gender identity or expression in a really systematic way. And so therefore, there's really no way to quantify the magnitude of this cancer burden or even the extent to which some of these risk factors may even translate to higher disease. In the past, we've been really limited by really small research samples or samples that are drawn only from LGBTQ community organizations, or maybe research that's only within a single geographic region. So we're really trying to combat this by collecting much more detailed data We think, for example, that collecting data among hundreds of thousands of individuals who we follow across time may be one of the best ways to fill this research gap. So we're trying to collect really high quality assessments, not only of sexual orientation, gender identity, and expression, but also getting really detailed data around cancer diagnoses, access to care, biomarkers, medical records, and a whole host of other data. And therefore, using this to then quantify the cancer burden impacting LGBTQ folks. We're really hoping to be able to sort of provide empirical evidence to then develop interventions and really also offer up some data that is not feasible for cancer registries to collect. So, for example, we think we can kind of understand or get a more nuanced understanding of factors across the whole life course that may confer different cancer risk. So, for example, we know that individuals who identify as LGBTQ are more likely when they were children to have been targeted for abuse, which we then know can trigger biological changes like early puberty, which we then know can be a risk factor for certain cancers like breast cancer. During adolescence, we see that, LGBTQ folks might not disclose their sexual orientation or gender identity and expression to a healthcare provider, and then may not be encouraged to seek adequate cancer prevention care, like getting a pap test. And then throughout adulthood, we see that LGBTQ folks, face these issues, like I mentioned. Maybe it's employment discrimination or less access to health insurance, or even access to cancer screenings like mammography or colonoscopy, than their heterosexual cisgender peers. So we're really hoping that, adding this research lens can really help us, move the field forward. I think without these data, we're going to see that LGBTQ folks may continue to be disproportionately burdened by cancers. So I'm so pleased to, have the support of the American Cancer Society and all of you doing all the work that you are doing on the ground. Thank you.
Hello again. I hope you enjoyed the presentation by Dr. Charlton. It was really important and helpful for us, I think, to have the level set around LGBTQ cancer disparities. We are so pleased as an organization to be able to fund researchers like Dr. Charlton, because that's how we're going to better understand how cancer disparities show up in disparate populations and what we need to do in order to achieve health equity. So thank you to Dr. Charlton and the many researchers that are advancing the work that we do here at the American Cancer Society. Now it's my privilege to introduce you to Charles Dwyer, a cancer survivor living in New England, who will share with us a bit of his personal and very, very real story. He'll give us insight into his diagnosis and the questions he was uncomfortable asking his doctor. We are both humbled and grateful that he has chosen to share with us his advice for things that he might have done differently to speak up during his own health journey. Now let's hear from Charles.
Hi, I'm Charles. I'm a cancer survivor. Back in 2017, I was approaching my 51st birthday, and my then husband said, what are you going to do? You're the public health person, so you know what you ought to do when you're 50. So I scheduled my colonoscopy. I saw the doctor, and he was terrific. Just so, what do I want to say? He's just got such a great manner about him, and made me feel very comfortable. I was, under sedation when it all happened. And when I woke up, he was by my bedside, actually. And he had a pretty concerned look on his face. He let me know that he had seen things when he was doing the colonoscopy that really indicated that I had colon cancer or some form of cancer. And later that was confirmed with an oncologist that I had colorectal cancer. And it was really right at between my rectum and my colon, and it wasn't a serious, or what I would want to say, it wasn't a late stage cancer. So it was certainly treatable. And in fact, I didn't need to have chemotherapy, which was terrific. But I did have a surgery that resected my sigmoid colon. And I wasn't quite sure whether I was going to need to have a colostomy or not. And that was pretty frightening to me. And just talking about those issues with the doctor, I just realized that I had all these fears about what my sex life was going to be like with my husband of really just a year at that point. And I just did not feel comfortable speaking with the surgeon about it. I did do some things that I really appreciate now, looking back. I brought my husband to every single patient visit that I could. And that really gave me the support I needed to have some of those really kind of awkward conversations, like when could I resume our sex life, etc. I would say, in hindsight, if I had it to do all over again, I probably would have reached out to someone who treated gay men more regularly. No issue with the gentleman that did such a great job with the surgery, but just, I could feel his discomfort, and I had to be his guide. And, luckily I could step up to that challenge, but again, hindsight being 2020, I might have done things a little different. I will say, for people out there who are putting off getting a colonoscopy, get one. Particularly, gay men who are sexually active, like me. I knew that I had always needed to sort of check that out. In fact, I checked in with my primary care physician about getting anal pap smear, but soon realized that was something that was way beyond his level of knowledge, comfort, etc. And since I've even learned that there's no guidelines for doing an anal pap smear, and it's part of why I'm wanting to be more involved with the LGBTQ cancer network, because we need them. People need to know, physicians need to know how to give an anal pap smear that brings back results that are reliable and that people can use to manage their health care. So, anyway, I'm here to say, get your colonoscopy. If you're 45 or older, I recommend it. Take care. Bye.
Well, we want to thank Charles again for sharing his story with us. There were certainly a number of reminders there. There's certainly, I think, for us, the takeaway around getting your colorectal cancer screening, and then also just a reminder of the nuances and the complexities around these conversations, which is why we're talking today about how we can empower and equip members of the LGBTQ community to speak up for their health. So thank you again, Charles. Now, what I'd like to do is to turn our focus to our panelists who have joined us today. We are so excited to have this wonderful panel of experts and organizers and folks that are really leading the fight in this space. So we have with us a number of panelists, the first of which is Vermont State Representative Taylor Small, who is the Director of Health and Wellness at the Pride Center of Vermont. Representative Small's pronouns are she and hers. Then we also have with us Dr. Scout, Executive Director of the National LGBT Cancer Network. Dr. Scout's pronouns are he and his. And then we also have Nandini, who is the Women's Health Project Management Coordinator at Fenway Health. Nandini's pronouns are she and her. Welcome, everyone.
Thank you. Great to be here.
It is really good to have you all here. I just want to remind our viewers that they can learn more about the incredible work that you all are doing in a digital resource guide that will be provided to everyone that has registered for this event. So there's more to come. We're certainly going to have a conversation over the next few minutes. We also invite our viewers to put questions in the chat, and hopefully we'll have some time to get to the questions. I'm going to get right to it because I know that we've got a lot of things to talk about today. So we have lined up a few of the most asked questions from ACS and our healthcare partners. Some questions were submitted during the registration process, and again, we're also inviting viewers to put questions into the chat. So to start us off, let's discuss why it's important for the LGBTQ community to speak up for their health, specifically screening and prevention. For example, one of our audience members wrote in asking us to touch on a comparison of cancer diagnoses and treatment for the LGBTQ population and disparities in care. And as we heard earlier from Dr. Choudhury, often a lack of data available to gain a broad perspective in addressing these disparities. So would love to get your thoughts on that. And I know there was probably 2 or 3 questions rolled into one. So maybe we'll start with why it's important to speak up for your health. And then let's perhaps go to the gaps around data collection and what we know there and what we need to be doing. Nandini, if it's okay, I'd like to start with you.
Absolutely. And thank you all for having me. And that's an excellent question. So to give a little bit of background on what I do, I'm a community engagement specialist within our reproductive health and women's health team here at Fenway Health. So my perspective is going to be from house. So, you know, in order for LGBTQIA+, non-binary and gender fluid folks and BIPOC folks who intersect with these identities to truly feel like they can advocate and speak up for their health, you know, specifically around cancer screening and prevention, I think we have to make sure that those screening and prevention methods are inclusive and trauma informed. And we also have health who are trained to use inclusive and non-discriminatory language in their practices. You know, I think screening and prevention methods are quite intrusive and invasive, and it can be really triggering to folks who have received harmful medical care prior to this screening visit. And when we establish screening methods that really reduce harm and trauma and use language that is inclusive and non-discriminatory, I think you're going to find that more LGBTQIA+ folks, non-binary and gender fluid folks, as well as BIPOC folks, will be more comfortable participating in screening and prevention methods that will ultimately feed into research and therefore generate the data that's needed. And I would also recommend, if it's at all possible, to establish research groups that truly focus on LGBTQIA+ and BIPOC health equity and cancer research. We have a research institute called the Fenway Institute that dedicates its work on health research pertaining to LGBTQIA+ and BIPOC communities.
Thank you, Nandini. That was really, I think, very helpful, not only for us as a panel, but for our viewers. There's so much there that I think we've got to remember when it comes to the experience that members of the community are having with healthcare providers. There was a video years ago that was entitled, "To Treat Me, You Have to Know Me," right? And so when you can have a clinician that has some experience and some understanding and is able to relate across difference even, right, I think it allows for a better experience from a patient perspective. So Taylor, I want to give you a chance to weigh in on that question as well.
Absolutely. And I think holding all of this is really recognizing the historical impact of our healthcare systems when it comes to LGBTQIA+ and BIPOC folks, and recognizing that specific to the LGBTQ+ community, what we've seen is that our identities are what are being diagnosed at the end of the day. And so when we're coming into these systems and having to advocate now for our own health and recognizing that we are moving beyond that point and having to build those trusting relationships with a healthcare system that is just coming around to recognizing and celebrating and affirming our identities, or hoping that that's the direction that we're moving in. And so I think there was a lot to learn in Charles' story that was shared around building a trusting relationship with your physician, being able to come and ask those questions when appropriate. I think there was a piece of community support, his partner asking him, "Hey, you just turned 50. You know what time it is. It's time to get your cancer screening." And then the last piece is bring in advocates with you. So whether that is your partner or whether that is a friend or a chosen family member who is there to hold those questions with you and hold that it can be really uncomfortable. As Nandini was saying, these are really intrusive screenings that are happening, but they are necessary in being able to identify the health needs in the long term. So I think there's a both and situation here. One is really recognizing and empowering folks in the community to be able to ask the difficult questions and to hold their needs at the forefront. And also that education piece for physicians and being able to, learn past their own biases or recognizing the implicit biases that they bring into their practice.
Thank you, Taylor. I could not agree more. I think there's so much work for us to do around discrimination in health. Right? So we know that when we're able to engage clinicians and providers that are more confident and more comfortable engaging, again, as I said earlier, a cost difference, again, the outcomes, the experience is just so different. So Scout, want to give you a chance to weigh in on that question as well.
Well, I think that, to talk about another facet of Charles's story, sometimes providers don't understand areas where we are at higher risk for certain types of cancer. One of the things that he did talk about is that his provider wasn't actually educated in how to give an anal pap smear, or the fact that right now anal cancer rates are quadrupling around the United States. And that's generally considered to be a result of the fact that we have long-term HIV positive survivors who are carrying HPV, not clearing it, and thus at much higher risk for some types of cancer, like anal cancer. Or to give another example of someone who's very beloved in the Boston area, actually is Chris Harris, who was a big party promoter and went to his provider and said, something's going wrong. And the provider, also not understanding that increased risk with this population, didn't realize and think to check for throat cancer, which is also associated with HPV. So here you have someone who was a delayed instance of getting any kind of diagnosis simply because the provider wasn't well educated about the increased risks our population carries. So I think part of that is, unfortunately, we may still have to educate ourselves a little bit more about some of those times when we may need to bring more information to provider. As a trans guy, trans folks are always doing this, unfortunately, because that's another big care gap. But, another piece I just want to touch on, as we did talk about data collection, and that was, I think, very important, is that related to data collection right now, the reason why we're not getting it in some of those registries is because those come from when a provider asks you what your demographics are when you first go to their office. So one of the things I just want to tell kind of our own population is, at some point, we really hope, because we're fighting hard to get it, that you're going to have a provider saying, are you LGBTQIA, as part of intake? And when you do, it's because people like us and the different allies and advocates have fought to get it there so that we can get information like this back-end cancer data.
So Scout, I want to stay there for just a second and maybe ask Nandini to chime in on why that's important, right? So I think I want our viewers to really understand, that we have these gaps when it comes to data collection, and they unfortunately are informing what's happening as much as they're informing what's not happening, right, around answers. And so Nandini, why is this piece so important?
I couldn't agree more. I think, Fenway Health is in a unique position where that is part of our intake and screening when we work with our clients and patients. So we're in a unique position where that's already factored in. So I would highly recommend clinics and hospitals that don't have that SOGI questionnaire, you put it in there. That's no longer an excuse for you not to put that in your questionnaire and intake form, because it's discriminatory, just point blank. And you're marginalizing populations who may not have access to Fenway Health, and their only option is to work with you, right? So just put it in there. I mean, it's kind of like a simple yet complicated recommendation, but at the end of the day, it's really not that complicated because it's just needed. So if you're truly going to take care of populations and communities, you need to make sure that you have an intake form and a questionnaire that gets to know your patient and client in a non-discriminatory and non-marginalized way. Otherwise, we're going to see, as as Representative Taylor and as Dr. Scout have mentioned, you're going to see these continued gaps in care, and then it falls on the communities to have to do that heavy lifting when it shouldn't have to be. That's our work as healthcare providers, as social workers, as folks who are within these systems. We can easily make that change.
Mm-hmm. Yeah, Nandini, I agree that we don't want to put the burden should not be on the patient, right? The healthcare system has to create an environment that's conducive to getting the type of information that's needed in order to, create treatment plans and ultimately have, favorable patient outcomes. So that's where the burden rests, not with the patient. Representative Taylor, anything you would add there?
I think what's really being highlighted is how we create affirming spaces for folks to know where they can go and see a provider. And so by asking that question, one, you're recognizing that those populations exist within your city, your state, your town. And second is recognizing the importance of collecting that data. So of course, there's this piece of increased education when we're asking these questions, but also I think so often we get erased in these conversations because that data is not being collected. So it also brings awareness to providers. When we're having conversations and doing trainings, I've talked to providers who are saying, I've never seen an LGBTQ patient before. And I challenge that and I say, yes, you have. You have seen an LGBTQ patient, but they haven't had the safety and availability to come out to you. So how are we creating those pathways for learning, but also the pathways for affirming care within our community?
Thank you, Taylor. That's a nice segue into our next question, which is how can members of the LGBTQ population be prepared and equipped to have these discussions with their providers? So we've talked about the healthcare system and the education that needs to happen there with folks that are driving the system. What can we do to help members of the community feel empowered to have these important conversations with their providers?
Well, I think Dr. Scout really highlighted this before, and recognizing that there are new technologies coming out that we are learning about within community and have to educate our providers about as well. So that is anal pap smears, that is doing testing for HPV of the throat, and recognizing that any form of penetrative sex is a conduit of HPV transmission. And so we've been able to identify, especially through Australian studies, that there is a direct correlation between HPV and cervical cancer. But I think we need to broaden that conversation as to the ways that HPV is affecting folks' body on the larger scale. And I think on the provider end is really recognizing that when we're talking about affirming care for cancer screenings, we're using the same tools for all of these cancer screenings, and it's the same screening that's being done, but it's accommodating that care and understanding the impact of hormone replacement therapy when working with trans individuals and the tools that are going to best be used, as well as understanding the results, knowing that for a cervical cancer screening on trans masculine or trans men people, what we're seeing is an increased, what is the word I'm looking for right now? Test results that are inconclusive, or test results that are coming back saying there's more testing needed. And so recognizing that correlation within the trans community is not automatically jumping to, okay, there's a risk of cancer here, but it is an open conversation as to how do we want to do this in the future, and how are we putting your health first, as folks were saying, and not putting that burden on the patient, but back onto the healthcare systems and supporting folks coming in.
Mm-hmm. So how can organizations like the American Cancer Society help with the education process? Because what I'm hearing is that, when it comes to the community, there are just knowledge gaps, right? And I think there's a role that public health organizations like the ACS can help in addressing those knowledge gaps. So any thoughts around what our organization and other organizations can do to help members of the community feel more empowered and become more educated? Nandini?
Yeah, I think this is where community engagement and outreach can be really innovative and helpful, where you, I know during the pandemic, it's hard to do in-person outreach and community events. So I know most of us are sticking to the virtual platform, but, I think establishing, either monthly or quarterly informational sessions on just reviewing what prevention and screening is, right? And talking about what are the different screening methods that are available for folks to know. And, making sure that it's not, just like a health lecture, right? It's not, you're not going to go on and on about statistics, but you kind of make it innovative and fun, right? You kind of can make it a situation where you kind of make a game out of it, right? It's like you're actually interacting with your community members to say, okay, so we're going to play screening bingo, right? This is what cervical cancer screening looks like. This is what an anal pap smear looks like. And make sure that it's not complicated, right? That you're not giving a medical school lecture. Instead, you're actually talking to your community members. And hopefully we can do this back in person soon and make it fun. But, I've had fun ways of doing this on the virtual platform, where we basically have like a virtual forum where we talk to community members. We have a conversation. It's a coffee chat versus a lecture.
Well, Nandini, we have to follow up after this event because we would love to get some of your tips for how we can do more things in the virtual space that are interactive and engaging. Prior to the pandemic, we used to do Pride events all across the country as an organization, and then we would have ongoing touch points with the communities post the Pride events. And then the pandemic, things have shifted. So we'd love to get some of your thoughts because you're
Absolutely.
right. It can't be you got to meet people where they are, right, in order to share the information with them. Dr. Scout, any thoughts there? And I know your organization does a lot of work in this space.
We do, but just like in this example, we just finished the Big Out Cancer Survivor Survey, 2,700 respondents. And one of the things we overwhelmingly saw coming out of it was that people said they wanted tailored resources and information for our communities, yet almost no one said they had any access to it. So one of the things we are saying to places like ACS and all the cancer centers around the country is, we can create it and we're going to be slow because we're tiny, right? Or everybody can create one thing and then start to help find the other things and pull it together. Because the nice part is with the internet, you can find a library of things, even if it's 7 different places that are putting it together. So I would encourage ACS to kind of think about how you could also be the lead on developing some of those tailored pieces of information that we're really looking for. I mean, all the way down to people wanted tailored information for the LGBTQIA+ population about physical activity as a way to reduce cancer risk, which is interesting because I'm tailored information, but it again talks to how all of us really respond when we feel like we're being talked to or our people are being talked to, or we resonate with the images that are coming at us. General population media doesn't speak to any kind of a discriminated against population in the same way as something tailored. Luckily, lots of that is much cheaper these days to accomplish, So yeah, anything that can happen related to increasing that resource base, I think will really serve the population. There's such a big need.
Yeah, that's a really good point, Dr. Scout. I know for us, we talk a lot about using the assets of the community to help inform the creation of our resources, right? And that's what makes it relatable, that's what makes it relevant, and that's what makes it useful. Quite frankly, we want to, create materials and share materials that bring value and ultimately help people take charge of their health in a way that's going to reduce their risk for cancer. So appreciate everyone's response there. So we introduced the pandemic. We know that we're still in this, COVID-19 reality. With that COVID-19 reality, we know that there has definitely been a delay in cancer screenings across most populations. And when you're talking about populations like the LGBTQ population, we know that, prior to the pandemic, we were seeing, lower screening rates. And so as a result of the pandemic, there's perhaps an even greater burden there. Can you all share any thoughts or stories around, what you all might be doing to help get folks screened, recognizing that there is sort of an additional element of fear and concern because of the pandemic when it comes to cancer screenings? Taylor, would you like to start?
I'd be happy to start on this
Thank
one.
you.
And I think you highlighted something really perfect there, which is that the pandemic is one reason why folks aren't getting access to screenings, and life in general is what I hear so often from community members is, I just forgot about it. I was caught up in the day-to-day. I was caught up in my work. I was caught up in my family's needs and wasn't thinking about my own health screenings. And an added layer of that is recognizing how gendered a lot of these cancer screenings are, especially when we're talking about breast and cervical cancer screenings. So one thing that we did in collaboration with the Vermont Department of Health was release a campaign that's called Got It, Pap It, and Got 'em, Screen 'em, really removing the gender from these body parts that we have and really honoring the fact that if you have these body parts, they should and need to be screened for cancer, and then giving really clear guidelines around when that needs to happen and how often. And we've seen a great response from community members and saying, wow, I didn't actually know that these guidelines were here, or I wasn't going to look at these guidelines before, because every time I talk to my gynecologist or I'm trying to get into a gynecological office, it is all women focused. And if I don't identify as a woman, I don't feel like that is the space for me to be able to interact with. And so I think it can be simple shifts in language, removing gendered language from our conversations when we're talking about cancer screenings, because honestly, it doesn't incorporate gender. We're really just focusing on various body parts and the screenings that are needed.
All right, well said. I think that's a drop the mic kind of moment, because I mean it's really critical, right? And when you think about it, it's one of those barriers that is keeping folks from getting the screenings that we know they need, and it's something that's an easy fix in many instances, right? It's not something that's really complicated to do. Nandini, anything that you would add?
I mean, that was perfect, Taylor. I mean, I couldn't have said it better myself. And honestly, I'm actually going to take this resource back to my workplace and share it with folks, because, I mean, that's something that we're working on ourselves, right? So, you know, we are a reproductive health group and we're the women's health team, right? So that's when you have women's health team, right? That is very binary, right? And so we're already excluding a lot of folks out of that, out of the population, and who would feel comfortable coming to us, right? So we're working on changing our language, right? So making sure that we are truly a welcoming space where when people just look at our title, right, they're not going to feel like they can't walk into our department and walk to our providers and feel safe and inclusive, and without having to be concerned about whether or not our providers are going to be strictly using binary language. And the fact of the matter is, it is a very simple change, as both Taylor and Dr. Scout have reminded us all, that this is an easy fix. If you're going to choose anything to fix, that is probably one thing that you can easily change within departments, right? Within scripture, what, you know, how you deliver letters, things like that. So I would just hammer that nail in further.
That's perfect, Nandini. Thank you. Scout, anything you would add?
Well, since our survey was done during COVID, we actually got some real insight into how COVID has affected people's cancer screening and care. And I think the saddest thing to see was when we had stories of people, and I was just talking with one earlier this week, where basically their screening was delayed by 10 months because of COVID, and they did have cancer. So, you know, as we continue to be reminded, cancer is not going to wait until COVID gets better, which means that there's a greater number of us right now who have cancer who don't realize it. So, you know, as a result of that coming out, of course, we've been actually madly doing trainings this year. I think we've done over 80 so far this year, with a whole bunch of providers about how to make sure they're doing a better job of reaching out to our communities, but then also to our community members. And one of the things that we're proud to be launching now is a sub-report on gender nonconforming and trans populations will come out during Trans Week of Visibility, which is in, 2 more weeks, something like that. And then we're also working on the BIPOC report too, which will come out in Black History Month, to try and make sure we spotlight the issues of survivors that are, you know, dually or triply infected and are impacted. And one of the things also to remember about our population, as we kind of touch on intersectionality too, is that actually a much larger percentage of the LGBTQI population identifies as BIPOC. So it's 42% of our communities compared to 24% of the general population. So we do have to remember, as we create resources, as we look at data, as we collect data, to make sure that we're also slicing it by the different types of our population so that we can really build things that are bridges to people's real lived experience.
I so appreciate that, Scout. I think one of the things that we have to keep, foremost in the conversation is the fact that, the intersectionality of the discussions that we're having, right? And there's so much that goes into being able to appropriately address the needs of all individuals that identify as LGBTQ, because it's not a monolith, right? And so we've got to be mindful of that. Well, we are having what I think is one of the best conversations that I've had in a really long time. Unfortunately, our time is getting short. So I want to just ask one additional question before we wrap up. We've talked a lot about screening and early detection. I want to talk about young people. I want to talk about our young people because I think we need to be talking about prevention. So how do we engage young members of the LGBTQ population around cancer prevention and reducing their risk for disease in general?
Who are you throwing it to?
We're
all patiently waiting. Is it us?
Scout, we'll go with you. How about that?
Okay, great. I think, the start of that is right now we have to understand, first of all, there's a fair amount of attacking going on legislatively with the young population. There are 70 bills that have been introduced or at a state level around the country that are almost all anti-trans specifically, and they almost all focus on young people. And that means that our young people are under a type of attack that we have not seen historically. And trust me, it was not good in the first place. Our rates of suicidality among the youth in our population are already horribly high. To add this onto it makes it worse. So I will have to say, if we're going to think about trying to engage people in doing healthy living care and cancer, which is a long-term, issue and risk factor, we have to first stabilize them and think about the idea that they can invest in their future because they see that they have a positive and productive future. So I really think with the youth population, it has to do with giving them hope for tomorrow and then engaging them in taking care of tomorrow as well.
Absolutely. It's the holistic thing, right? So it's not just the cancer piece. We've got to be engaging with our young people holistically. Nandini, I saw you kind of giving a snap there. So what would you say?
Yeah, this is my wheelhouse actually. So what I've done is touching on that holistic piece, right? And the whole body health. So what we've done is that we've created events that focus on youth health, right? And it's across the board. And it comes in the form of innovative and fun activities. So a couple of weeks ago, we actually did a self-care with love art workshop where we had an art facilitator come in and teach young kids across all identities, LGBTQIA+, intersecting with BIPOC identities, to describe their bodies, their mental health through art, right? So you're finding this very beautiful way of talking about your body and health that's not strictly medical, right? It's not like strictly under a medical lens. And then within that workshop, we talked about ways of establishing hope. I mean, Dr. Scout, your focus on making sure that these kids have an established place of hope is so vital. If you don't have that, then we're going to see that mental health decline, and you're going to see the harm increase steadily throughout the years, throughout the months, even throughout the weeks, let's just say, right? So centered on was that hope piece, that planting that seed of you matter, your body matters, yourself matters, and this is how we're going to help you set yourself for a best life. And here are the resources that we can give you to find those safe havens that you can go to when you feel that nobody else is listening. And it was a beautiful event, and we did catering, we had music, it was, I think that's a really great example of how you can do that for these kids, while on the big picture, with legislative wars happening, you combat that way, if that makes sense.
It does. And Nandini, it sounds like your center has some really great community engagement efforts that you all are employing. So much more that I think we can learn from the work that you're doing. Taylor, anything that you would add?
I mean, only signal boosting what these two have shared already. And it really brings me back to Dr. Charlton's piece before and thinking about how LGBTQIA plus identities are not the risk factor for cancer or for other diseases. The risk factor is systems that are not supporting folks within the community. The risk factor is increased substance use disorder because of response to a society that is not supportive, in response to these legislative attacks that are happening. And so what I hear is really arming our youth with coping skills through this. And I think one of the most powerful tools that we can give is community, recognizing that our youth have just such a beautiful vision for the future and also have such amazing supports within one another. And so we might have some of these solutions, but I think the youth and creating space for LGBTQ youth to be able to come together and share those resources is probably one of the best things that we can do in preventative care for the future.
I so agree. So when we talk about identity or orientation or race, that's not the problem. It's the negative isms, right, that are impacting all of what we're talking about today. So I want to do this. I'm taking liberty here. I want to give us 20 seconds each to just do a round robin call to action real quick. What's one thing that you would ask our viewers to take away and act on from this conversation? Nandini, you're up first.
Okay, so for my folks who are healthcare providers, community organizers, social workers within whatever capacity, whether it's a hospital or community organization, that you take the courage to make the change within your internal organization to make sure that your language is inclusive, that you are stepping away from binary language, that you're truly anti-racist and combating transphobia. When you do those internal changes, that shows the community that you are a safe space. So please do that.
All right, love that. Have the courage to make the change. Taylor.
I would say to fellow community members, engage in those conversations with your loved ones, with your chosen family, with your friends about cancer screenings, and really reduce the stigma around getting access to the care that you need. I think this can come up in the realm of mental health and just being those supports for one another. But also, as we're talking about preventative care, it means engaging in those community conversations at large.
All right, community conversations, have them with your loved ones and your village. Appreciate that. Scout.
I'm going to give kind of a simple one, but it could be disruptive. If you ever see any place where they're asking demographic information and they're not also asking LGBTQIA, say why. If that's whether it's the intake at your medical place, or if you work at a medical place and you don't have it there, or if it's in any other kind of survey. We don't fix problems without the data to show us that the problem exists. Until that time, they're kind of forcing us to stay in the closet, and we're ready to be out of it.
All right, so Scout is calling us to be disruptors, and I'm there with Scout because, one of the things we know is that, you got to be able to call a thing, right?
Yeah,
so if something ain't
you
right, you got to say it ain't right.
Yeah.
Otherwise, it doesn't change. So I love that. I love this conversation. It has been so insightful, but unfortunately, we are out of time for today. But you can keep the conversation going by, again, leveraging the digital resource guide that's going to be going to all of the participants today. I want to thank our panelists, Representative Taylor Smith, Dr. Scout, and Nandini Choudhury. And thank you to the organizations that you represent, the Pride Center of Vermont, the National LGBT Cancer Network, and Fenway Health for your ongoing partnership. We hope everyone was inspired by the discussion just as much as we have been. So thank you again, and we look forward to having continued conversation as we serve our communities and help advance health equity. Have a wonderful afternoon, everyone.
Thank you once again to everyone who participated in this important discussion around cancer's effect on the LGBTQ+ community. In particular, we're grateful to all the sponsors recognized on the screen before and after today's program. Addressing health inequities and cancer outcomes requires all of us. We hope you leave here today better understanding why you should speak up for your health and inspired with ways you can promote wellness within your own community. We welcome everyone to learn more and to encourage your own family and friends and those around you to become advocates for your own health. Talk to your healthcare provider about what cancer screenings are right for you. We also invite you to learn more about ACS and ACS Can by visiting www.cancer.org and discover ways to get involved. If you haven't already registered, please do so using the link in the chat. Once you are registered, look for a follow-up email with online resources curated by the American Cancer Society and its healthcare partners. Thank you so much for being here with us.